Rachel, I've been wanting to come on your show for months and months. You've been asking me to come on your show for months and months, and it's just gotten blocked. I mean, let's call it what it is. It just got blocked because they didn't like the way you handle things, and they didn't want me on there. I mean, it was so clear when we sent it down. Why would you want to go on Rachel Maddow's show? Well, because I like her and she's really good. It doesn't make any difference.
Hello, my friends, and welcome to the circus. So, we posited quite some time ago, I say back in September, November time period, that the reopening of the United States economy, at least to the extent that they were going to allow it to bounce back, was going to happen, of course, during the beginning parts of the Biden administration, at least that they were going to create a situation in which they wanted that to happen. And since it seems to be going in the direction of there is a Biden administration, I think it prudent to understand what exactly we were predicting back then. I came across this article, All Hail the Reopening, and it's actually quite eye-opening about what is really going on right now as far as narrative shifting, perception management, just how much power each faction of these elites actually control. How much of this is within their control to change the public psyche. But the main thing I got directly out of that article that I want to cite is this. CNN has removed the death tracker from its main page, while the New York Times has reported a 33% decline in new cases in the past 2 weeks. Plus, the Times, which arguably made the most profound contribution to the public panic over the virus, is finally reporting on the terrible carnage. And that's the terrible carnage of the lockdowns instead of the terrible carnage of the CV. So CNN removed its death tracker already? See, there's no legitimate statistical reason to do that. It's this complacent acceptance of this kind of perception management that is getting us into these situations that we're in, and that it's only going to get worse until we start pointing this stuff out. So that's the main thing out of the All Hail the Reopening article. But the author is generally pointing to, well, looky here, all the same states, all the same governors, all the same figures, all the same people who put CV patients in nursing homes and refuse to open their states and happen to have voting irregularities and happen to be Democrat controlled. Here they are all reversing course within the first month of the Biden administration, but they have their defense, right? Because they started back in September, so it couldn't have been about administrations. We'll talk about that later. But it's true. The D.C. mayor confirms indoor bar and restaurant service to resume at 25% capacity starting when? January 22nd. When was the inauguration again? The mayor of Chicago is pushing Chicago bars and restaurants to reopen for indoor dining as quickly as possible. This is a complete reversal for Beetlejuice. And she's actually threatening to sue the teachers' unions if they don't go back to school. Chicago school systems locks out some teachers, withholds pay for not returning to in-person instruction. So now Chicago is the place where if the teachers' union tries to not go back to a school, they're going to hammer you for it. That's one way to get everybody to swap right back to the way things were, isn't it? Cuomo, Mr. Nipple Rings himself, the guy who held daily CV press conferences that were watched by millions of people, supposedly. Even Cuomo, who has literally destroyed the economy of the New York City and hence New York State, even Cuomo says it's time to start reopening the economy. Now that all of our small businesses are destroyed, it's time to reopen our economy so that Amazon and Walmart can buy up the rest of what's left. Thanks, Cuomo, thanks. No wonder your state is hemorrhaging millionaires and billionaires. I looked over at Jersey because what I figured I would do is let's just go by state of the states that were openly against President Trump. And let's see what their plans are as far as reopening. This is Jersey. Stage 2, their real restrictive stages, was over on January 2nd, 2021, and now they're in Stage 3, which has just expanded everything on its way back to normal. I wonder what it's going to be like down the shore 2021. I bet you it'll be a lot like down the shore 2018. Of course, Pennsylvania, another one of the states that have imposed the hardest restrictions against the CV for the longest amounts of time. Even Pennsylvania is lifting its toughest restrictions. But of course, like they say, this is all according to plan. It's not like we're doing this now because a certain somebody is in office. We told you a month ago that this was happening. And I'm going to show you an old video clip from one of my videos from literally back in September, and you'll find it very interesting. So this is obviously perception management, but the most important thing about it is it's the tip report. It's the same Democrat strategists and rhino Republicans, the deep state, the administrative state, the two wings of the same bird, the bureaucratic nightmare that is running our country, is shifting the narrative, shifting the perception. I mean, the most obvious example of this would be the NPR story change. January 19, that's prior to inauguration, as death rate accelerates, U.S. records 400,000 lives lost to the CV. But then after inauguration, current deadly U.S. CV surge has peaked, researchers say. Well, isn't that a bit of good news a day later? Isn't it funny how all this is happening? It's almost like it just all happened to come together. Now, but guys, it's not because a president just took office. It just happens to be that all these things are coming together. And man, I tell you, some of these governors who I've really been irritated the most by, they're announcing these announcements now that moving into the Biden administration. The way they're doing these announcements is so conceited and annoying. Let's just look at a couple of these people, how they're doing this. First and foremost, to all you Michiganders, Governor Gretchen Wilson, or I think that's her name, whatever her name is, she's always been a friend to you guys, and she's so excited to announce the lifting of these restrictions now that a normal president is in office and we can all go back to our normal lives, right?
Today, the Department of Health and Human Services is issuing an epidemic order to resume indoor dining on Monday, February 1st. I know this pandemic has hurt our restaurant owners, our restaurant workers. I want you to know that I will continue to do everything in my power to support you and your families.
Continue? Continue? What have you done to support restaurateurs and their families? Continue? This is the I keep saying these are let them eat cake moments, but they just keep doing moment after moment after moment, and nobody really seems to be bothered by it. But Queen Gretchen is going to allow Michiganders to be able to go to restaurants again. Well, isn't that nice? But, there's going to be some severe restrictions that go along with that. She just wants you to be able to see the, quote, light at the end of the tunnel after we get through this dark winter. They will overcome. Isn't this amazing? Meanwhile, in Massachusetts, the same thing is going on now. So how many states have we covered? All blue states, all right? But of course, nothing comes close to the lockdowns that have been going on in California, am I right? I mean, no, they're like New Zealand's way worse. And there's even, I could argue, other states that have been worse. But what a coinky-dink, we're going to have a turnaround in California too.
Good morning, Pilar. That's right. So we have been in regional stay-at-home orders for over 6 weeks now. The governor broke down the state into 5 regions, and if those regions were at limited capacity for ICU and hospitals below 15%, they were ordered to shut down pretty much all indoor operations. Today, later this morning, Governor Newsom is expected to lift all of those regional stay-at-home orders, but there is some confusion here because our ICU capacity remains at 0% this morning.
This is what quasi-normal reporting looks like. This is why you always want to try to go local media. And I'm going to show you an example later on of just outright propaganda that comes around from this same situation. But he's saying, I don't know why Newsom's even lifting these orders. We have no capacity still at this point in our ICUs. And if you're saying you're making a projection that at some point in the future it's going to get better, don't you think we should at least wait until that happens happens before we do this. But oh my boy, that reporter's confused because it has nothing to do with the ICUs.
But state health officials say in the next 4 weeks they are projecting that to increase, to improve, but exactly how, they haven't released very much information on the.
So they say, oh, in the next 4 weeks, we project that things are going to get way better in the ICUs. I know that we have 100% capacity, 0% available right now, but we're projecting in the next 4 weeks, this is going to be a lot better. Wink, wink, nudge, nudge. And the reporter's like, they didn't really make it exactly clear how they came to that conclusion.
Calculation leading them to those results. But a lot of businesses here paying attention to what the governor will be announcing later this morning. It could mean at least some services will be allowed to resume across the state, really, and especially here in Southern California.
Meanwhile, in Massachusetts,
decline in the state's COVID numbers is a big reason why you'll see a rollback of restrictions starting Monday. And here to explain is Dr. Shira Daron, the hospital epidemiologist at Tufts Medical Center. Good to see you.
You too.
So just a couple weeks ago, you were pretty concerned about the data. Now we're seeing this steady decrease in new cases. Do you think the second surge here has peaked?
Well, the numbers here in Massachusetts are certainly looking more favorable. New cases, percent positivity, hospitalizations, and deaths are all decreasing or leveling off. And that's consistent with the idea that holiday gatherings and travel led to a surge in COVID-19 infections, and that we're now past that. But what we do need to watch for now is the possibility that a new, more contagious variant of the virus could become widespread and drive those cases back up. So
don't you just hate when you can see them reading and they are throwing in this kind of stuff and it's just like talking points, you know? Yeah, everything's down, 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 but you know what we really need to be concerned about is a new variant that could come out and force us all to go directly back into these draconian lockdown. Well, why do we need to be worried about that? Shouldn't we be worried about what's going on now, or should we sit around and fret about one that hasn't ever even come to the earth yet? A mutation that hasn't even happened yet. That's what she's saying we should be fretting about. It's back to that thing where I said there's a specific kind of fear that they're looking for with the quote invisible enemy, and that's dread. Fear of the unknown. That's what really gets you into the lowest frequency spot. So here we go. Things are looking better across the board in Massachusetts. We got the jab coming in, so according to them that's going to be awesome. But don't let go of your fear, don't let go of your dread, because there could be a mutant form of it that comes back and takes and makes everything back to the way it was.
So it's not time to let our guard down.
So along those lines, Governor Baker plans to lift that 9:30 p.m. curfew for businesses and restaurants, as well as that overnight stay-at-home advisory for the rest of us. Do you think that's a good idea right now?
You know, the governor continues to be data-driven and evidence-based in his decision-making. Businesses and restaurants.
Okay, but what? This is hilarious to me. So he's data-driven, and so what's the data exactly that's causing him to open the restaurants again? Here we go.
Businesses and restaurants have not been shown to be a significant source of spread of infection, and it's not.
So why were we closing them?
Clear that the additional measures that were instituted in November and December actually helped.
And they don't even know if the lockdowns helped. Talk about being data driven. Well, we can all thank the governor of Massachusetts. Wow. Unbelievable. I think we should hear that all again. Let's just hear what she says again. He's data-driven, and then
businesses and restaurants have not been shown to be a significant source of spread of infection, and it's not clear that the additional measures that were instituted in November and December actually helped.
Wow. So this channel covered a story in Nashville where the administration officials in Nashville were actively trying to cover up CV data that showed that there wasn't a lot of spread in bars and restaurants in Nashville. And they were trying to hide that. We covered it, but it never made it to, obviously, corporate news because they don't want that kind of thing to spread. But here we are, post-Trump, and now it's time to admit, oh, well, there was never any good evidence that the lockdowns benefited. There was never any good evidence that closing restaurants changed anything or that there was big spreading events at restaurants. This is insane because you have this professor at Tufts University in Massachusetts who's talking to the governor, represents the medical establishment, saying all these things, lining up with others. But even next, we're going to listen to Governor Wolf, right? And Governor Wolf he's the worst at duping delight. First of all, that's what annoys me about him. So everything he's going to say, he's going to have this little smirk on his face while he's talking about deaths. And it's just, I just hate these people. But Governor Wolf's going to say the lockdowns worked. Well, which is it?
As we prepare to move into the new year, we all have a lot to reflect on from the year we're moving out of. Obviously, 2020 was a tough one for all of us due to the COVID-19 pandemic.
Due to you, Governor Wolf, because of you.
It was not easy. And we're all tired. We all feel run down by the demands of this year. But we can all carry a bit of hope that this new year is going to be brighter than the old. We're learning a lot more about COVID-19 every day. And we've come a long way from that day in March when I announced the first presumed positive cases of COVID-19 in Pennsylvania. Our country was unable at that point to reliably test for the virus in the earliest days of the pandemic. And now 2 vaccines, a lot's changed. 2 vaccines have been approved for use in the United States. And the federal government's Operation Warp Speed is working to distribute the vaccines that have been approved to providers all across the country. We've learned how to treat patients who contract severe cases of COVID-19, and then we learned how to treat them even better.
Wow, look at all these amazing things that all of a sudden we're doing about the CV. I mean, this is such a change. What a turnaround in a few days. This is the man that was constantly out there talking about just as much of a dark winter as Biden, and yet listen to the glaring, amazing things that have happened under his watch in the past few days. It's amazing.
Recovery rates are improving, and people aren't staying in the hospital as long as they were at the beginning of this pandemic. But again, the fight against this dangerous disease is not over. We all need to stay the course, and we all need to continue to do everything in our power to slow the spread of COVID-19 and keep our families and our communities safe. There have been some positive signs lately. Our statewide percent positivity rate went down this week for the 2nd week in a row. And while the number of hospitalizations and deaths remain entirely too high in Pennsylvania, it appears that the number of new cases reported each day has plateaued. That means that our mitigation efforts over the past several weeks have done what they were intended to do.
Oh, okay. Well, that's interesting because the science on these mitigation efforts, locking people down, is still out. And I'm not quite sure you know what plateau means.
The mask wearing requirements, that stays.
But now I just want you to listen. This man's announcing good news that he's opening the restaurants and bars, even at 25% capacity. He's going to allow the little people to start their little businesses up again, but just only at a little bit percentage. But after he gives that little bit of good news, this is how he proceeds to talk to the citizens of his state.
The mask wearing requirements, that stays. Gathering limits based on venue size, that stays. Business capacity limits, that stays, and restaurant self-certification. But we can all have hope that next year...
He sounds like a parent chiding his child who maybe just did something good and is getting a small part of his grounding lifted. This is how the ruling elite are talking to us as they make this giant shift. They're like I said months ago, they got to turn the ship, so they got to turn it early. And the ship's just moving in this different direction, and now they're going to really put it on. Because at the beginning, by March 2021...
We can all have hope that next year we're going to be in a lot better place. We're going to have a lot brighter ending than the ending that we have in this year. By working together, we can keep one another safe while we wait for the vaccine that is on the way.
Now, I made a video back in September where I was talking about how this information was going to have to be shifted early so that it wasn't obvious. And I just want to play this back for you guys. Okay, and this is from September 2020 going into the wintertime, 2 months before the elections. But this is what I laid out. But I don't think that that's it. If we look at the examples I gave of the schools earlier in the episode, all the schools are going back on November 4th. What I see this as is the WHO is making the pivot back to some sort of normality. The globalist plan is to install Biden, and once Biden is president, to shift the perception to make it seem like there is so much progress all of a sudden being made on the CV and on other various things. They kind of have to start turning the ship early. And that's all this is. It's a pivot. The WHO wants a return to normality in November, just like the schools. And so they're coming out with a policy shift or a subject matter pivot that's going to turn them back towards what they wish to be the new normal. Notice that they start this pivoting before the vax is out. This means that the narrative shift is beginning. So even if you have tons and tons of friends that are plugged in, it shows you that this information will trickle down to them eventually. And that's exactly what's happened. It's very easy to see. And then I wanted to show you that because I knew that there would be people on the television, in media, and all these different places saying, well, this is obviously not because of the election, because it started prior to the election, and it's BS. I'm going to play one such example for you now, and we're also going to look at something else that she says, because if you'll remember, I told you at the beginning of the episode to keep note of the way that local reporter reported on his story. She's going to take a different tact, and the obvious difference is this lady, whatever her name is on Harris Faulkner's show, the lady on the left, she is a propagandist, just like 99.9% on the television. But I just want you to look specifically at how heavily the Biden propaganda is coming through with her. All right, let's go.
No, absolutely. And I know that the Biden administration is fully focused on ensuring that we do meet that 1 million vaccinations a day plan so that we can get to 100 million in the first 100 days. But you're absolutely right. We're losing around 4,500 Americans each day. ICUs are packed. But I was looking at what's been released.
ICUs are packed, but hey, no worries. Everybody's opening up.
But I was looking at what's been released from Governor Newsom's office, for instance, and they are looking at projections for hospitalizations over the next month. This is information that hasn't been made publicly available yet, but that's what they're going on. That is good news if these vaccinations are moving us closer to a place where we can be doing things like dining. But Harris.
So wow, so very interesting how she reports on that situation. Let's go back and listen to how the local reporter reported it.
But there is some confusion here because our ICU capacity remains at 0% this morning, but state health officials say in the next 4 weeks they are projecting that to increase, to improve, but exactly how, they haven't released very much information on the calculation leading them to those results. But a lot of businesses here paying attention.
So they haven't released any of the information that has shown what's leading to them to this information.
But I was looking at what's been released from Governor Newsom's office, for instance, and they are looking at projections for hospitalizations over the next month. This is information that hasn't been made publicly available yet, but that's what they're going on. That is good news if these vaccinations are moving us closer to a place where we can be doing things like dining. But Harris, you and I have talked about this a number of times. The closures of restaurants,
when they were shutting everything down.
But hospitalizations were lower when you were shutting everything down, when Gavin Newsom was shutting everything down. How do you explain that they're opening now when hospitalization is at 100%?
I don't disagree with you. And
were they following the science or not?
I've been saddened, obviously, walking around to see this. But I would add that, like in New York City, for instance, indoor dining shut down on December 11th, well over a month after President Trump legally and lawfully lost the election. So this wasn't something that's happening necessarily in these big blue cities and states just because they wanted to give Biden a pat on the back. They did this in December and later in November. So it wasn't about the election.
And there you go. Exactly like we predicted back in September of 2020, before the election had even happened. And they were making these moves. Exactly the defense that we were expecting to hear, we hear out of this propagandist. So in the few minutes that she's propagandizing the American public on Fox News. She takes information about Gavin Newsom's office and she misrepresents it, and then she proceeds to attempt to defend Governor Cuomo's irrational shutting down of all indoor dining when, as Harris Faulkner points out, the hospitalization rates were much better when you shut everything down than they are now when you're opening them. Explain that. And she doesn't explain that. She dodges it and moves into another Biden talking point. It's unbelievable.
But I would add that, like in New York City, for instance, indoor dining shut down on December 11th, well over a month after President Trump legally and lawfully lost the election. So this wasn't something that's happening necessarily in these big blue cities and states just because they wanted to give Biden a pat on the back. They did this in December and later in November. So it wasn't about the election.
Look at that little propagandist giving that talking point. Isn't it so funny? The fact is they started this subject matter pivot, this change in perception, this perception management campaign over the CV. They started it months ago. Hell, they started it when they started the entire thing. We're in for a world of hurt. A lot of unnecessary division and a lot of back and forth between a lot of people who really have more in common than not. I'm telling you. But I'm going over a Jimmy Dore interview with Chris Hedges in the next few days, and I'm telling you, it's going to be very eye-opening for you guys if you watch it along with me. I hope that you will. In the meantime, like, share, subscribe to the channel. I'm gonna upload this and I might even go live tonight, who knows. Thank you so much to everybody who supports this channel, who likes and subscribes to my channel and shares it, and of course to my special few who donate to me. I appreciate you guys' support more than you'll ever know. I don't want to mention you by name, but you guys know who you are. Thank you very much, and I will talk to you guys again soon. Peace.